ਅੱਜ ਦੇ ਸੈਗਮੈਂਟ ਵਿੱਚ ਅਸੀਂ ਤੁਹਾਡੀ ਮੁਲਾਕਾਤ ਕਰਾਵਾਂਗੇ ਦੋ ਮਹਿਮਾਨਾਂ ਨਾਲ ਤੇ ਖਾਸ ਤੌਰ ਉੱਤੇ ਲੇਡੀਜ਼ ਵਾਸਤੇ ਇਹ ਇਨਫੋਰਮੇਸ਼ਨ ਬਹੁਤ ਹੀ ਇਨਫੋਰਮੇਟਿਵ ਹੋਏਗੀ ਜਿਹੜੀ ਕਿ ਮੈਨੋਪੌਜ਼ ਵਿੱਚ ਆਉਂਦੀਆਂ ਨੇ। ਮੇਰੇ ਨਾਲ ਐਲਨ ਗਲਾਸਰ ਜਿਹੜੇ ਕਿ ਇੱਕ ਫਾਰਮਾਸਿਸਟ ਹਨ ਤੇ ਮੌਰੀਨ ਮੈਗਰਾ ਜਿਹੜੇ ਕਿ CKNW ਦੇ ਉੱਤੇ ਇੱਕ ਲੇਟ ਨਾਈਟ ਸ਼ੋਅ ਲੈ ਕੇ ਆਉਂਦੇ ਨੇ, ਉਹ ਸਾਡੇ ਨਾਲ ਗੱਲਬਾਤ ਕਰਨਗੇ। ਵੈਲਕਮ ਟੂ ਦ ਪ੍ਰੋਗਰਾਮ। Thank you. So, Mark, Alan, we'll start with you. That you have come up with some especially ointments and medicines which you feel are required for those women who are going into menopause or who have gone into menopause. So, why did you think about this?
Well, number one, in talking to Maureen, because she deals with plants at the end of the line who have been in menopause for years and ended up actually, many women with urinary incontinence problem. And that's a problem where leaking urine is never normal. We want to stop that. One of the problems when women, before they go into menopause, after they go into menopause, is vaginal dryness. Right. And that's never been talked about. Not discussed really in pharmacy school or medicine. I went to school with the docs, that in anatomy class or physiology, we didn't bring that up. And yet this is a real issue in many, many women. So we have vaginal moisturizers that work, that are natural products, some of them, to help alleviate the problem.
This is a very critical phase in any woman's life, you know, when they are passing through this phase or going to this phase. With your experience as a sex educator, what do you feel? Why is it important that women at this particular age need to know much more than what they know?
It's really important. You know, sex and anything related to vaginal health can often be a taboo subject and it's not discussed. Right. And oftentimes doctors don't know what to do about it and patients don't bring it up either. So vaginal dryness can affect any woman, especially women who are breastfeeding, on the pill, who are perimenopausal, the years leading up to menopause, or menopause. And what happens is the estrogen receptors decrease in the urogenital tract, and that may lead to vaginal dryness and painful sex, and that can impact a woman's intimacy and her intimate relationship with her husband. But it doesn't just impact women who are sexually active. Vaginal dryness can impact any woman's life. So it's very important that women understand if they are experiencing vaginal dryness, and it might feel like sandpaper down there, that's how many describe, that there are treatments available and there are hormone-free personal moisturizers that are available to treat this.
So you shouldn't be afraid of talking about this, that's what you're saying, because generally these kind of topics nobody wants to discuss, and what to do at that time is also a great concern. So again, when you talk, and what is coming out basically, that are there any particular reasons? Is it just because of menopause that this dryness comes, or there are some other reasons also?
Well, stress may lead to vaginal dryness. Also breastfeeding may lead to vaginal dryness. Women on the birth control pill may experience vaginal dryness as well. So it affects about 70% of women all along the reproductive life cycle and all along life and after menopause. And it's really important that a woman's vagina is healthy and has a pH balance, or their pH is in balance, so that they can ward off any infections, any vaginal infections or urinary tract infections, which can actually be detrimental to a woman's life.
And Alan, being a pharmacist, you know, what kind of experience you have about, like, when women come, how do they express themselves? And like Maureen was telling, that about 70% of the women do face this situation.
That's right.
So how is it dealt with?
So typically, medically, and I see it, well, number one is prescriptions. Right. There's female hormones in a cream form that's inserted vaginally. That's called, one of the brands is Premarin. That's one of the more normal solutions. And yet we have these natural products here, one of which is Joy Gel, where the feedback from women who use it tell me they don't have to use a prescription drug as much. They can use a natural product to accomplish the same thing.
So now what we are finding out is that people are going away from those drugs. They want to go away because the negative impact of those drugs really creates more problems for people instead of solving it. So in the market, what are you seeing, Maureen, the coming up of natural products? Is it making a difference in people's lives?
Well, people like to have an all-natural option to begin with in particular. And in one case where it's really important is in those women who have had reproductive cancers. They also will experience vaginal dryness, and quite often doctors will not recommend estrogen, low-dose localized estrogen for those women, but those women experience vaginal dryness, so they are particularly happy that there is a hormone-free option for them. So a lot of women like to treat their vaginal dryness with something that is hormone-free, just because they are uncomfortable with the use of low-dose localized estrogen therapy.
Right.
That's safe, though, as well, I have to say. But a lot of women want to start on something that is natural, and Joy Gel is all natural.
Right.
It's an all-natural product.
So apart from that, sex is an integral part of any couple's life or anyone, but question is that a time comes, do you also find that because of these problems, these can lead to separation also, because one is not being able to understand the complications? And with your experience, when you do talk shows and meet people and talk to them, what would you like to tell us about that?
Absolutely, because it's such a taboo subject still, and women are uncomfortable about talking about it with their partners or their physician, and they don't know what's going wrong, they tend to be silent on it, and so there's no discussion. And
Right.
I've had many patients come into my clinical practice and tell me that their marriage is on the brink of divorce because they're unable to have sex or have intimate relations with their husband, and their husband is very upset about that. And so they don't know what treatment is available. Their doctor may not have provided any treatment options for them.
Right.
So, and I had a patient who was 42 years old, and that was happening to her. Or women who have gotten divorced because of painful sex.
Right.
And often the partner will think, or the husband might think, his wife is having an extramarital affair because she's not wanting to desire sex with him. And so it can lead to a whole host of problems. And
Right.
when you say I'm experiencing vaginal dryness or sandpaper down there, a man also doesn't want to hurt a woman either.
Right.
So it really can lead to lots of changes in the bedroom.
And another thing is that, are these products to be used regularly then, or these are just for for use when required? How do you go about for that?
Okay, so there's two kinds of products, and what we talked about here is vaginal moisturizers that are normally applied 2 or 3 times a week.
Right.
There's personal lubricants, that's what
Right.
they're called, when you want to have intercourse, and that's KY jelly or other
But
things
they
like
don't
that.
treat the problem,
No.
the lubricants. They're a
That's
bit of a
right.
Band-Aid solution during intimate times.
Okay.
And so that's why personal moisturizers are such a much better choice for women.
Okay.
That's right. And so we do have a selection, Gynatrof, Prep Again, and Joy.
Right. So in the market, lots of things are available, but the best thing is, as you said, the natural moisturizers are much better than the other things.
For some women,
Right.
you know, some women may need the low-dose localized estrogen therapy if
Right.
vaginal dryness advances to a condition called vaginal atrophy, for example. They may need that. Women have a lot of choice today in terms of the personal moisturizer that they can use.
Right.
I would like to say as well, this is lifelong therapy. If you stop using the personal moisturizer, your vaginal dryness will return, and it may even be worse. So this is the one symptom of menopause that does not get better
Right.
with time, unlike hot flashes and night sweats and anxiety and heart palpitations. Those will often resolve in a woman after 5 years. But vaginal dryness is something that is lifelong for women, so they need the treatment lifelong.
Thank you very much for this information. Thank you.
Thank
You're
you.
very welcome.
ਜੋ ਸਾਡੇ ਮਹਿਮਾਨਾਂ ਨੇ ਅੱਜ ਗੱਲਬਾਤ ਕੀਤੀ, ਉਹ ਔਰਤਾਂ ਜਿਹੜੀਆਂ ਮੈਨੋਪੌਜ਼ ਵਿੱਚ ਜਾਂਦੀਆਂ ਨੇ, ਉਹ ਉਸ ਦੇ ਬਾਅਦ ਜਿਹੜੀਆਂ ਇਸ਼ੂਜ਼ ਹੁੰਦੇ ਨੇ, ਪ੍ਰੋਬਲਮਸ ਹੁੰਦੇ ਨੇ, ਚੈਲੰਜਸ ਹੁੰਦੇ ਨੇ, ਉਸ ਵਾਸਤੇ ਇਹਨਾਂ ਨੇ ਦੱਸਿਆ ਕਿ ਪਹਿਲੀ ਗੱਲ ਤਾਂ ਡਾਕਟਰ ਨਾਲ ਸਲਾਹ ਕੀਤੀ ਜਾਏ, ਤੇ ਹੁਣ ਮਾਰਕੀਟ ਵਿੱਚ ਬਹੁਤ ਸਾਰੀਆਂ ਐਸੀਆਂ ਚੀਜ਼ਾਂ ਅਵੇਲੇਬਲ ਨੇ, ਜਿਸ ਤਰ੍ਹਾਂ ਕਿ ਨੈਚੁਰਲ ਮੋਇਸਚਰਾਈਜ਼ਰ ਦੀ ਇਹਨਾਂ ਨੇ ਗੱਲ ਕੀਤੀ ਕਿ ਉਹਨਾਂ ਦੀ ਵਰਤੋਂ ਨਾਲ ਇੰਟੀਮੇਸੀ ਕਪਲਸ ਦੇ ਵਿੱਚ ਬੈਟਰ ਹੋ ਸਕਦੀ ਹੈ, ਤੇ ਜਿਹੜੀਆਂ ਸਮੱਸਿਆਵਾਂ ਉਹ ਫੇਸ ਕਰਦੇ ਨੇ ਉਸ ਦਾ ਇੱਕ ਉਹਨਾਂ ਨੂੰ ਬਾਹਰ ਰਾਹ ਜਿਹੜਾ ਹੈ ਮਿਲ ਸਕਦਾ ਹੈਗਾ।